Hey guys, welcome back to Medical Coding with Blue. We all know what today is. It's Quiz Friday. I hope you all are just as excited as I am about today's exercise. Before I start talking about what the questions are, I want to just bring up a little bit of housekeeping. I did throw in some more procedures on here. Please look at your modifier references because I did put more modifier usage on these questions here, okay? So, as always, I will be including the questions down in the description box below. We will talk about the answers on Answer Monday. If you have a 2017, 2018, or 2019 CPT book, you should be good to go because I don't think these procedure codes have changed that I'm referring to on this exercise. For the diagnosis codes, if you have a 2018 or 2019 version of the ICD-10 book, you should be good to go. I don't know about years that are earlier than that because I don't have that book anymore. So, if you have any questions, be sure to email me. I will always include my email address down in the description box below. So, let's get started. Number 1 is a left wrist ganglion cyst, and an injection was performed into the left ganglion cyst. Okay, that's number 1. Number 2 is aspiration pneumonia due to food regurgitation. Okay. Number 3 is parrot fever. I have to do that. Like, of course, I know I've had to use that code before. When I did an exercise before, I used parrot fever. So it's just like, parrot fever. Sorry. That's a very serious thing. I shouldn't be dancing to it, but it is kind of cool, the name anyway. Okay, number 4. The patient has left and right carpal tunnel, and they had a right carpal tunnel injection performed. Okay. Number 5 is left primary osteoarthritis of the shoulder. Okay, and they had a steroid injection performed into the left acromioclavicular joint. Number 6 is a migraine with refractory migraine, and they received a bilateral botox injection for this migraine. Okay. Number 7 is acute appendicitis, and they had a laparoscopic appendectomy. Number 8, okay, so I want all of the diagnosis that I'm talking about plus the procedure. All right, so the patient has bilateral knee osteoarthritis, primary osteoarthritis, okay, and the patient is morbidly obese with a BMI of 45. A therapeutic steroid injection was performed on the right with ultrasound guidance. The provider documents that due to the patient's increased adipose tissue surrounding the joint, additional time and manipulation was needed to locate the joint to perform the injection. Okay. Number 9, epigastric hernia that is reducible, and the patient had a laparoscopic epigastric hernia repair. Okay. And number 10, and this is just a procedure code that I'm looking for, a diagnostic spinal cord tap. And that's it. That is Quiz Friday. I will be putting the questions down in the box below. So anyway, today was a very productive day at work. I did get a lot of stuff done. I have been working on a couple of projects that I have going at the same time. They're sort of simultaneous because I have 2 classes that I'm looking at doing in the month of August. So I still have plenty of time, but I always feel like if I don't get started on it now, it's not going to get done. And August, I do take time off from work. I do take time off just to sort of give myself some downtime. And, you know, I want to make sure that everything gets done beforehand because Once the summer starts getting into August, it's going to be like a freaking freight train, you know? And then, of course, in September is conference, which I'm so freaking excited about. So, anyway, I hope you all have a great evening. And if you have any questions, please let me know. I will be leaving my email address in the description box. And I hope you all have a great and safe weekend. And I will see y'all for Answer Monday. All right. Have a good day. Bye.